Now coming to the pathophysiology. In clinical practice, myocardial infarction is the most common underlying condition leading to cardiac arrest. The underlying mechanism include ventricular fibrillation in about 60 to 80% of the cases, severe bradyarrhythmia, asystole or electromechanical dissociation, pulseless electrical activity or PEA in about 20% of the cases, cardiac rupture in around 5 to 10% of the cases. The clinical presentation of the cardiac arrest is very dramatic and sudden. So sudden collapse with loss of consciousness, apnea or gasping, or completely absent respiration, absent carotid or femoral pulses, a history of sudden onset chest pain, suggestive of myocardial infarction may be present in some patients. Now let's talk about the diagnosis of the cardiac arrest. So diagnosis is primarily on the basis of the clinical setting. So it is based on sudden collapse, gasping or absent breathing, absent carotid and femoral pulsation. So to confirm the cardiac arrest, check the responsiveness of the patient by shaking or shouting. There will be no response. Very important point to remember is do not waste time trying to check pupillary reflexes. Pupillary dilatation is not diagnostic. So do not waste time attempting to record blood pressure. So resuscitation must be started immediately if you see this kind of the symptoms or sudden diagnosis. So importance of the early resuscitation is cardiac arrest is a grave medical emergency. If resuscitation is not started within 4 to 6 minutes, irreversible brain damage and death can occur. The resuscitation procedure is called cardiopulmonary resuscitation or CPR. CPR consists of BLS, basic life support, and advanced cardiac life support, ACLS. So in next video, we are going to talk about the BLS and the ACLS separately. So in conclusion, cardiac arrest is a sudden stoppage of the heart activity. Ventricular fibrillation in myocardial infarction is the most common cause. Diagnosis is clinical. Immediate CPR saves life. Every minute matters.